to introduce themselves.
Hi everyone, my name is Deborah Ike. I'm the Francophone and West Africa Regional Manager of the Global TB Caucus, and I apologize in advance for any background noise. I'm away on work travel and I'm with my infant daughter, so please, thank you.
Not a problem. Thank you so much, Ms. Ike, and we are very privileged to have you with us this morning. Thank you for joining us. The SATB Secretariat.
Good morning, everyone. My name is Dr. Kensani Kwashu from SANAC, and we are the South African Global Caucus Secretariat. Thank you.
Thank you so much, Ms. Nakashu.
Good morning. That's my name.
Sound.
Yes, ma'am, the second presenter just broke up. If you can perhaps just repeat.
Okay, apologies for that. Good morning, my name is Matshidiso Sopodi. I'm the TB Technical Advisor from SANAC.
Thank you so much for joining us this morning as well. And then the Western Cape Department of Health.
Good morning, everybody. I'm Dr. Vanessa Moodley from the Department of Health at Service Priorities Coordination.
Thank you so much.
And good morning, everybody. I'm Dr. Noshina Furfre, also from Service Priorities Coordination.
Thank you so much for joining us. And it's an all-women lineup that warms one's heart, definitely. Colleagues, at this point, I will just provide some brief context before we immediately go over to our presentations. We have in advance asked our presenters to keep it to a maximum of 15 minutes because we do want to provide members adequate time to pose their questions as well. And yes, as I said, unfortunately, load shedding is hindering our operations this morning. So it might also be best going forward as far as possible to have our meetings in person. So, honourable members, the Western Cape Provincial Parliament ad hoc committee on TB was established on the 30th of September 2022 by the Speaker of the Western Cape Provincial Parliament in accordance with Standing Rule 119, subsection 1, subsection B. And this committee consists out of 15 members that was appointed in accordance with Rule 120 of our standing rules. And this committee obviously consists of all political parties that are represented in the Western Cape Provincial Parliament. And the purpose of this ad hoc committee is to conduct oversight over the work of the provincial executive with regards to its response to TB-related matters. And that will include oversight over any provincial executive authority or any provincial department and any provincial organ of state and any provincial entity that is involved in activities dealing with TB-related matters. Honourable members, if it's all good with you, there's no other questions for clarity, I would then ask immediately for the Global TB Caucus presenters to kindly take us through their presentation, and then immediately after the presentation, for honourable members to pose their necessary questions. Ms. Ike, the floor is yours, ma'am. You would be able to share your screen then. Thank you very much. Members have also received the relevant presentations.
Sorry, I would ask if you could share from your side, please.
Mr. Daza, will that be possible for you?
Great.
Yes, Chair.
Thank you so much. Everyone can see the screen?
We can see, Chair. Thank you very much.
Thank you very much, Member Brankhuis. You may proceed, Ms. Ike.
Thank you very much, and thank you, Chair. Thank you, distinguished members of Parliament, and to every participant who is here. Thank you for the platform that has been given to the caucus to make this presentation. I'll be making this presentation on behalf of my colleague, Paidamoyo Magaya, who is the Anglophone Regional Manager. She's unavoidably absent, and that's why I'm making this presentation on her behalf. So by way of introduction, the Global TB Caucus is an independent network of over 2,500 parliamentarians with support in more than 150 countries of the world who are dedicated and work individually to accelerate progress against tuberculosis. The caucus exists in 4 regions, which are Europe, Central Asia, Africa, Americas, the Asia Pacific, and 2 linguistic groups, which are the Francophone and the Lusophone network. So we work in 3 different levels. We work at the international level, the regional level, and the national level. At the global level, the work of the Global TB Caucus is in partnership across countries to target groups such as the G20 with coordinated messaging and calls to action. And at the regional level, we work together within different regional networks and regions and platforms to share experience and to agree on different joint actions that can enhance the response to TB at the national level and also at the regional level and at the national level. That is where the backbone of our work is. That is where we're able to measure the impact of the work that we do at the global level. At the national level, our focus is really on building groups, for example, like what you have in the Western Cape, to form national caucuses and to work in the fight against tuberculosis. So by way of speaking about Africa, because we're in Africa, so I'd like to talk more on the African region. The region is divided into 3 regions. Africa region divided into 3 regions. We have the Anglophone, we have the Francophone, and we have the Lusophone. So, and to narrow down, because we're an Anglophone, we have 5 co-chairs from Nigeria, Kenya, Zambia, Namibia, and Cameroon. And those are the names of our honorable members who are the lead MPs that drive the advocacy and meet at the regional level to discuss and give direction to the region. And in Africa, we have countries with active MPs, for example, Kenya, Nigeria, Zambia, Zimbabwe, the Western Cape, Eswatini, Lesotho, Chad, DR Congo. Namibia's caucus was launched just last month. It was so good. And we are looking forward to more actions from there. And we have countries where our members are not currently active, some members are new. And some of these, this is as a result of the fact that some parliamentarians that were engaged in the past did not get re-elected into parliament. And so therefore, the commitment in that country is sort of dwindling. But we are looking forward to, revitalizing efforts in those countries in the coming year. And we have countries where we need to relaunch and reestablish caucuses afresh, like South Africa. South Africa is one of the countries that we really, really want to enhance our engagement. We have Ethiopia, we have the South Sudan, we have Liberia and Botswana. And we have countries where we don't have civil society focal points. Civil society form the bedrock of the work that we do in the Global TB Caucus. Without civil society, we are not able to provide localized support to our parliamentarians. And so in these countries, we are looking for civil society representatives that we can, work with to support parliamentarians more domestically. And already I'm talking to seasoned parliamentarians and partners, and I know that parliamentarians know what their role is in the fight against TB. But just to refresh that parliamentarians are uniquely positioned to echo the voices of TB-affected communities. Parliamentarians are able to drive advocacy at all levels, like I mentioned earlier, and parliamentarians complement the advocacy that civil society organizations are already into. Also, parliamentarians push advocacy in parliament, they move motions, they drive advocacy for investment in TB at the domestic level and also at the global level. For example, the last Global Fund replenishment, we saw parliamentarians mobilized and pushing, towards a full replenishment. And we want to thank every parliamentarian here who must have been part of that campaign. Also, parliamentarians hold governments accountable. There are different commitments that have been made at the global level. I think your slide is a bit backward. I'm on the next slide now, actually. Yeah. So parliamentarians hold governments accountable. They are the ones that are able to talk to our political representatives at the highest levels to ensure that the commitments that are made at the global level are followed through even at the national level. So just to say that financing for TB is very, very important and crucial at this point in time where we are. Since the start of COVID-19, the global community has mobilized over 15 trillion USD, in the fight against COVID-19, and the annual funding gap, I beg your pardon, for TB is still 3.3 billion USD, at the global level, and this clearly demonstrates that resource mobilization is possible and funds for diseases are available. But the question is, do we have the people that will help us, pull down these resources for actions? So there are collective priorities that the caucus members globally have been pushing for and will continue to push for example, urging ministries of health, finance, development, to prioritize adequate funding towards health and to tuberculosis, to press our governments and relevant multilateral agencies to promote and ensure global access to medicines, vaccines, medical equipment, and fund for research and development in the face of not only COVID-19, but also tuberculosis. For example, TB vaccine, we know that BCG is over 100 years old, but we still do not have a vaccine for tuberculosis. And these are some of the activities, these are some of the advocacies that we need parliamentarians to drive, to push, to ensure that we get what we want. Other things are listed there, but for want of time, just to say that we need parliamentarians to work with civil society organizations to ensure that the rights of people affected by tuberculosis is protected and promoted. People continue to die from this disease because of lack of adequate laws and policies that can protect and promote their rights. Stigma and discrimination remains a major barrier to ending tuberculosis, and parliamentarians have a key role to play in ensuring that stigma does not continue to hinder the efforts. The funds can be allocated, yes, but the question is, do we have the enabling environment to end tuberculosis? And I'll leave parliamentarians here with that question, today to say that, do we have the laws? Do we have the policies that we can use to drive TB out of our countries, even if we have the funding? I'll just round up by some case studies. For example, from countries like Kenya, Zimbabwe, and Nigeria. Kenya has seen improvements, in the fight against TB. especially around funding through continued advocacy efforts of the National Caucus in Kenya, led by Honorable Stephen Mule, who was very, and is still engaged in the budgeting process and also influential in the allocation process. For example, the funds that the Global Fund allocated to Kenya, Honorable Stephen Mule would normally follow up to ensure that every single funds that are allocated are spent well, but not just him alone, but with the support of the National Caucus in Kenya. Honorable Stephen Mule in April 2022 received an award of leadership, in Kenya, where he was crowned as the best in Kenya and the fourth in Africa on his role and contribution to legislation, constituency development, and political leadership in TB response. Also, Honorable Stephen Mule continues to work to drive and increase political leadership and attention to TB in Kenya. Kenya is among the 5 countries that hosted the Global Fund preparatory meetings ahead of the 7th replenishment. Another good example that we have is Zimbabwe. Zimbabwe pushed for an increase in domestic allocation for health to 14% of their national budget. Kenya, sorry, I beg your pardon. Zimbabwe is also removed from the countries with triple burden of TB, HIV, MDR-TB. Also, over a third of the parliament already signed the Barcelona Declaration to end TB. There are several other good examples from Zimbabwe. Again, for example, public HIV and TB testing by caucus members to reduce stigma, like I mentioned earlier, and mobilize communities for positive health-seeking behavior, and also successful in advocating for representation, full representation in the United Nations high-level meeting on TB that happened in 2018. And before I round up, I'll just add Nigeria to the list to say that in the peak of the COVID-19 pandemic, we had Honorable Abubakar Dahiru Sariki, who is the chairman of the AIDS, Tuberculosis and Malaria Control Committee and the National TB Caucus chair. He wrote to the Presidential Task Force on COVID and said, hey, while you are allocating resources to COVID, diverting resources and repurposing funds, ensure that you integrate TB into COVID-19 services. And these, amongst the efforts of other stakeholders, resulted in the creation of partnership between Nigeria Center for Disease Control, that's the NCDC, and the TB program, working together to integrate TB into some components of COVID-19 control measures. And I'll tell you that a major outcome from these intervention resulted in Nigeria being listed amongst WHO to record an increase in TB notification instead of a decrease in the midst of COVID-19 pandemic. We all heard the predictions that were made in the beginning, but Nigeria was able to turn that around by reason of parliamentary actions and also efforts of other stakeholders. Other examples include press briefings, joint National Assembly meetings with the Minister of Health, parliamentary motions on the urgent need for to address the public health crisis of tuberculosis in Nigeria, which was sponsored by Honorable Benjamin Okezie Kalu. And as a result of this, several things begin to accelerate in the parliament, and he got noticed by the Stop TB Partnership, and he was awarded for his outstanding contribution to ending TB in Nigeria through legislative actions during the National TB Conference. Time will fail me to go through everything, but just to quickly flag that Nigeria is currently working on a TB-specific legislation to address issues around stigma and discrimination, and also to make the TB program an independent agency that can easily access funds and drive its own advocacy. as a road to 2023, I'll finalize by saying that the regional work plan for Africa is currently being finalized and will be shared in early 2023 for national caucuses to domesticate. And I hope and I believe that the Western Cape will align to this duly. Also, there will be a tuberculosis-only United Nations high-level meeting in 2023, and we really urge parliamentarians from the Western Cape to take the lead in ensuring that there is a strong in-country advocacy towards that UNHLM that will happen in 2023, to ensure that there is a strong delegation from your country towards the UNHLM, and also so that the goal of ending TB by 2030 can be achieved collectively. Because if the whole world does their part and you do not do your part, we cannot end tuberculosis. I thank you once again for your time. I thank you for the platform, and I'm grateful for your continuous commitment. Thank you so much. I remain Deborah Ike.
Thank you so much, Ms. Deborah Ike, and thank you so much for this insightful presentation this morning and the wonderful work that you and the partners are doing, and especially for the insight into Africa as well. Honourable members, at this point, I will now afford you the opportunity to ask your specific questions in relation to the presentation we just had. By the show of hands. I see Honourable Christians, and then I recognize Honourable Peter Maree in that order. You may proceed, members.
Thank you, Chairperson, and thank you for the presentation. It's like you said, you know, it gives us just an insight of what is happening. And really, Chairperson, it's not a question, but just a comment, because the presenter is actually asking us as a provincial parliament to make people more aware and to take up the fight. We know TB is with us for a long time. And I don't know if people are, our communities, especially the communities suffering from TB, if it's rolled out properly in communities. I know a lot has been done, but the plea from the presenter today is that I think that we should do more for awareness, and also partnerships, do more when it comes to partnerships. But most of all, that we push for some sort of vaccine going forward, because, the figures is astonishing about people dying because of not being aware. So this is, TB is with us, especially we know in impoverished communities. And we should really, and this committee it plays a crucial role in order to roll it out and to assist and to see how we partner and how we, and I think the presenter has given quite a lot what we can do. And when it comes to partnerships, being the voice, doing whatever we should do. So Chair, it was a good presentation. It's not a question, just a comment. It's for me a plea, a desperate plea for more help, more assistance, and more awareness. Thank you, Chair.
Thank you very much for your comment, Honourable Christians. Honourable Maree, you may proceed.
Thank you so much, Chair Lady. TB, it's shocking to hear that we are so far behind South Africa in the fight against TB. We had a wake-up call when people started contracting HIV in South Africa, and I was manager and founder of a special life care center, AIDS center in Elsies River, where most of the people that we had there admitted that they actually contracted tuberculosis when their immune system was down. And thousands of South Africans contracted HIV and died of tuberculosis as a consequence. So when you say that in terms of your global TB caucuses, that you must reactivate or South Africa to take part in regional caucuses. I'm shocked. Why is South Africa not part of regional parliamentarian caucuses yet? And then I would like to know also, in the case of COVID-19, WHO, quickly, they spent billions to find the vaccine, which could minimize the effect if people should contract COVID-19. What have been done to try over centuries now to find similar vaccine against tuberculosis? Or is it because it mostly affects only the poor? The wealthy gets HIV/AIDS just as well as the poor, and so do the wealthy also contract HIV and COVID-19, but then very seldom wealthy people get tuberculosis, which shows you it derives from the fact that these people are undernourished, weak immune systems, staying very uninhabitable housing units where a lot of people in one room, disease is spread. Why is there no protocol against the wearing of masks for people who's got tuberculosis? They can or they don't have to wear masks. But you've got that in the case of COVID-19. And these people just go about coughing if they have it very bad. And there's no regulation from the national ministers to say you've got to do A, B, and C if you have been tested for tuberculosis. Or do we wait till the person is sick and then send him to tertiary hospitals? Shouldn't this be something where greater focus is placed on preventative primary health care? Thank you.
Thank you so much for your question, Honorable Marie. I do not see any other further hands from any other members. Let me just double check. Don't want to leave anyone behind. I don't see any other hands. Ms. Dike, if I can perhaps just also just in terms of what Honorable Marie made mention of, the lapsing of the SA National TB Caucus, and the re-establishment thereof. What is the current status and what was the reason for it not being operational? And what is the ultimate process to get the SA caucus re-established? And also, what is the impact on provinces ultimately? And then one would also want to know in that context, what is the impact there of possible funding to South Africa? And the mechanism, is there a mechanism then for provinces or specifically to the Western Cape to still gain access to those global funding? Yes, I think I will conclude with that. Ms. Ike, you may proceed. Thank you so much.
Thank you so much, Honorable, and thank you, Randy, for the questions. And I'll just start by saying that it's really, despite this picture, it's still really encouraging that the Global TB Caucus was formed by Honorable Lord. Right now he's a Lord, so I would call him by his present nomenclature. He's Lord Nick Herbert of the South Downs, CBE, and he co-founded it with Honorable Aaron Motsoaledi, the former Minister of Health of South Africa. And the fact that right now we do not have, a strong leadership from South Africa is probably due to maybe re-elections, and stuff like that. But this has implications for the TB response in South Africa and also the other provinces, because the louder, the more the merrier. And also, South Africa is a very, very strategic country. It's a high burden, country as well. And during international high-level meetings, I know that, yes, the other officials, they try to be there, ministers and all that, but we still need parliamentarians. And that's why I'm happy that you all are asking these questions, and I'm hoping that this would also help us to reactivate what we have there. So we penned South Africa down because we are looking for a champion, from the Parliament of South Africa, even if it's one person that we can lay our hands on, somebody that is willing and capable of driving this response in South Africa and leading us to other parliamentarians in that in the Parliament to relaunch the National Caucus, because we probably lost the members that we had due to elections and all. So if we can get support of honorable members who are here on the call to identify a champion to link us up with, and then we can take it up from there. We have the structure, we have all the documents that we need to share, and if possible, we can even come all the way there, to ensure that things are done for that caucus to be launched. It has implication on funding, because when parliamentarians put their voices, put their competence into budgeting process, because parliamentarians understand the issues, they know why the funding needs to be increased, they know where the funding needs to go to. They are the ones that can even carry out oversight to ensure that the funds allocated are translated into impact. So if we do not have that strong national caucus in South Africa, definitely it has implication on the funding. And so therefore, I'll just end by that plea that if we can get the support of MPs here on the call to identify, an MP from South Africa who we can liaise with to revitalize that caucus, we'll be very grateful for that. I hope I managed to answer the questions. Thank you.
Thank you very much, Ms. Ike. Honorable Marie, is there any follow-up from your side? Member Marie.
Thank you. Question. Do you have a sorry?
Yes, is this a follow-up question or is the new question on the presentation?
No, it is a follow-up question.
Thank you, Member Marie.
Question, I asked the question, what role do you think primary healthcare should play in preventing people from getting tuberculosis? It seems we're concentrating more on curative measures after the person has contracted TB, then we're trying to find ways to cure them. So I want to know what measures are being taken to prevent people from contracting tuberculosis. Shouldn't more money be spent on primary health care instead of curative measures? That is a question I would like, first of all, I want to ask more than one question at a time, because I would like a full answer. Thank you.
Thank you very much, Member Marie. Ms. Ike.
Okay, thank you for that question. And in my presentation, I had mentioned earlier that even if we have all the funding to buy the equipment and everything, we need to prevent TB. And to prevent tuberculosis, we need the laws, we need the policies in place that can tackle stigma and discrimination. Because if stigma and discrimination continues to exist, then people cannot even, test, go to the health facilities freely to test for the disease. Also, if stigma and discrimination continues to exist, then people will not be able to come out openly or go to get tested, and they will continue to spread the disease. And if people continue to spread the disease, then we'll continue to have new infection and reinfection, and we will not be able to end TB. So that's why I mentioned earlier about the laws, the policies, against stigma and against discrimination. And also, like you rightly said, primary healthcare strengthening is very, very key. And that's why more funding needs to be put in place to make sure that our health systems are strengthened to be able to provide quality TB services to prevent the spread of the disease. Because some healthcare facilities are even so bad, so dilapidated, to the point that they are even centers for reinfection, So some people might even come to the health care facility and even get infected, So like you rightly said, we need to strengthen our health systems. Primary healthcare strengthening is very, very key to preventing the further spread of the disease. Thank you.
Thank you very much, Ms. Ike. I do see another hand, Matsiliso Sopoli. I have not noted you with the introductions. Are you from the Global Caucus? Would you want to contribute?
Yes, Honorable Chair, I would like to contribute. This is Matsiliso Sopoli. I did, Chair, introduce myself as...
Oh, I'm so sorry.
Yes. So
please do.
I just wanted to add on the question, respond on some of the questions that the Honorable Member asked with regard to the PHC in the country and the Global Fund grant support. So the health facilities, Chair, they do screen all the clients that comes to the facilities for TB, but then in our presentation, as we present later on, you will see some of the challenges that makes TB to continue to be a problem in the country. That is like, the issues are beyond Department of Health. So in our presentation, we do say some of the global commitments that were made, and our country was part of the countries that made those commitments, that we need a multi-sectoral accountability on TB, where all sectors, we don't want TB now to be the problem of Department of Health only. We want all other government departments, like we did, with HIV, like the Honorable Member mentioned earlier on, we did with COVID. So with TB, we also need other sectors to come on board and support the Department of Health with the TB response. I also saw Professor Hausler joining with regard to Global Fund. We have got Global Fund grant that is also supporting all the facilities with the TB response, where they are promoting quality improvement. And Western Cape is one of the provinces, that is City of Cape Town, that is benefiting from the Global Fund grant. Professor Haru Hausler's organization, TB HIV Care, was funded for this, but they seem to not to, have he will talk for himself, but with the Department of Health, they couldn't reach an agreement, but then a different organization will be supporting Western Cape with the TB in health facilities and in communities also. So there are lots of interventions, Chair, that are going on, but the gap at the moment is we need support outside the Department of Health. We need other sectors to come on board. Hence, the caucus is key to bring all these other sectors outside health to support the Department of Health with the TB response in the country. Thank you, Chair.
Thank you very much, ma'am. Your input is much appreciated as well. Member Marie, I still see your hand up.
Yes, lady. I'm sorry. Thank you, Chair. I said I didn't want to ask all my follow-up questions at the same time. I want them to focus on each question. So my other follow-up question is, in terms of a global TB caucus, which is an independent body of 2,500 members, stretching across 150 countries. Now, what shocked me is that Botswana and South Africa, where most TB cases has been reported, especially the Western Cape, we're the capital of TB. And here we don't even have a parliamentary caucus. So now I want to ask, this parliamentary caucus, must it be from the national parliament And seeing the Western Cape is mostly affected by the TB crisis, why can't the Western Cape Parliament be part of the TB caucuses regionally? Because regionally you say that's for parliaments, and internationally it is for countries. So we are not a country. The Western Cape is a province with its own constitution. Would you say the Western Cape will be welcome to be part of the regional TB caucus?
Thank you, Member Marais. Honourable members, before we proceed and hand over back to Ms. Ike, I just also note that Professor Harry Housel has also joined us. Professor, good morning to you and welcome to our first official meeting. I would also just allow you the opportunity to kindly introduce yourself to the meeting.
Thank you, Chair, and apologies for joining late. I didn't receive the link for the meeting until just now, so I do apologize for joining late. But I really welcome this opportunity to engage with the parliamentarians, with you, Chair, and the members. We have, you and I have discussed on several occasions the importance of provincial TB caucus, and it's been discussed at the Provincial Council on AIDS and TB. I think what's really important about the idea of a TB caucus and at whatever level, be it provincial, national, or global, is that it's a commitment of across all political parties for politicians to say that TB is an important issue, and clearly in this province, it's a major cause of burden of disease. In fact, in South Africa, amazingly, 153 people die of TB every day, despite it being a preventable and curable disease. So I think this kind of a commitment from politicians towards signing up to raise awareness of TB, look at any legislation that would facilitate access to TB services, and then also to mobilize adequate resources and the TB response is really important for the province to consider, especially given that the Western Cape was the first and only province to launch a TB emergency response plan. And what Sidi had mentioned earlier is really critical, is that we need a multi-sectoral response for TB. It can't just be health on its own, it needs to be all government departments in partnership with civil society and the private sector. Thank you.
Thank you so much, Professor Housel, and we look forward to having your inputs and most welcome. We do apologize that you were only able to receive the link this morning. We'll make sure that you do receive the communication well in advance going forward. Member Marais, okay, you post your follow-up. Ms. Ike, I give back to you now. Thank you.
Thank you so much. I'm very, very happy about this feedback and the interest really in everything that we've said. So with regards to the Western Cape, I think, yes, every single province, every single sector, every single, a part of a country that wants to launch a national caucus, a provincial caucus, is welcome to do so. And the Global TB Caucus Secretariat is readily available to provide you with every necessary guideline that you need to launch such a caucus. And of course, when this caucus is launched, it can be integrated into either the national caucus or the regional caucus. But at the regional level, we are very, very open to discussing and to supporting you through the process. Thank you.
Thank you very much, Ms. Ike. Honourable members, I do not see any other further hands. Member Marais, are you happy to an extent?
I am delighted that the Western Cape can join and they can be invited, and that they will look at a greater focus on primary healthcare instead of curative healthcare. The other thing is the money. Africa is renowned for getting billions and spending it on wasteful expenditure and other things. What control measures are there to make sure that money from the global fund given to any African country, including South Africa, is actually spent exactly for the purpose for which it was supposed to have been used? Are there sufficient control measures to make sure the money don't land up in somebody's mattress?
Thank you very much, Honourable Marais. In terms of our mandate, it's clear then that we do have our work cut out for us. Honourable members, I think at this point we conclude with the session with the Global TB Caucus. Ms. Deborah, you are most welcome to stay with us if you so wish, but we are really much appreciative of your presentation this morning, also the input for answering the questions. I'm sure that really gives members quite insight into what you're doing and how we can also approach the Global TB Caucus going forward. So thank you so much. Honourable members, we are now in the next point of our agenda, which is the presentation from the SATB Secretariat, and the presenter will be Dr. Nkashu. Thank you so much, ma'am. You may proceed. Mr. Daza, will you also be sharing the presentation, please? Thank you.
Good morning again, colleagues, and thank you very much for inviting us to this meeting. So as indicated, that we are from SANAC, which is the South Africa National AIDS Council, which was launched by the South African government. And it is also important to notice, to actually indicate that all the work that SANAC does, it reports directly to the Deputy President of the country. So as much as the name says South African National AIDS Council, we don't only focus on HIV only, but we also focus mainly also on TB and STIs and other pandemics that will affect South Africa in the future and the ones that have affected us in the past. So our presentation outline, first let's speak indicating briefly who are we, and also indicate the TB caucus background and the progress made to date and the role of the TB caucus members and SANAC support to all the provincial caucuses that have been launched and the ones that are going to be launched in the future in the Republic. So who is SANAC? As highlighted briefly, that we are the South African National AIDS Council, which was established by the South African government cabinet to coordinate the national response of HIV, TB, and STIs. Hence, you will remember that this is why we've got the provincial AIDS councils or the PCAs who are placed in each and every province, who reports directly to the premiers of the province, which is also aligned with the work that we're talking about today, that all the epidemics or the pandemics, because of their nature, they need to be managed at a higher level. So the main aim of the structure is to build consensus across all the government, civil society, and all other stakeholders to drive and enhance country response to scourges of HIV, TB, and STIs. So we don't only necessarily work with government only, but work with government, work with civil society organizations or structures who are on the ground, and the private sector. And recently, we've also noted that it is good for us to include also the funders that are out there, the partners, the ones that we consider as partners, who is your PEPFAR, who has USAID and also CDC on the ground, the WHO's, let me maybe say all the UN families. So all of us, irrespective, I like it when I heard one of the members saying that, you know what, irrespective of which political affiliation you are, but we are saying that the fight against HIV, TB, and STIs is not one political organization only, but it's for all of us as South Africans, even if you are politicians, so that we can reduce these epidemics in the country. And then the SANAC Secretariat, it exists to implement the objectives of the SANAC trust establishment in terms of it being a trust. So how do all the work link to the National Strategic Plan or for HIV, TB, and STIs? Where we are currently, we have been busy implementing the National Strategic Plan for HIV, TB, and STI that was launched in 2017 to 2022. Currently, we are also in the midst actually of compiling a new strategy that will talk about the responses from 2023 to 2028 with the aim of ending HIV by 2030 in line with the global commitments that South Africa as a country we have committed to. And also it aligns with our national plans. Then the goals that we are currently implementing is goal number 1, which mostly, talks about the accelerate prevention in order to reduce new HIV and TB infection and new STIs. So I'll only stop on this goal and I will not mention all the other ones with the understanding that the members have received this presentation. But I will also link goal number 1 to goal number 6, which look at promote leadership at all levels and share accountability for delivering this plan. This plan will talk about the response to HIV, we talk about the response to TB, we talk about the response to STIs. So in this meeting now, when we're talking about the caucuses, we're talking about TB and again, linking it to our leaders with the understanding that all our political leaders and all the leaders, whether you are in private or you are in government, all of us, we need to work together to ensure that we reduce this TB and TB infection, as Prof. Henry has highlighted, that it is a disease that can actually be cured. That if all of us who put our efforts together and we are accountable to all our actions, we will be able to end TB as an epidemic or as a pandemic, specifically in South Africa, because we've got the highest burden of TB across all our provinces. Then I'm going to hand over the presentation to my colleague here, who will take you further more on the issue of the TB caucus background, how it was started in South Africa, indicating where are we currently and what is the way forward. But it is important for us to highlight that all the provinces here in South Africa were expected to have the TB caucus, and some of them were functional, some of them are not functional anymore. Hence, we are in this journey of ensuring that we enhance or we revigorate, some of them that have died. But South Africa as a country, we are definitely part of the global TB caucus. So Tsidi will take you further.
Thanks, Dr. Nkwashu. Through you, Chair. I won't go through this slide because Ms. Deborah has already taken us through this slide on the progress globally on the TB caucus. I will go through the next slide. That again repeating that TB caucus is a network of political representatives, and they work together collectively to respond to the TB program at different government levels. And the role of members is really, like Ms. Deborah has mentioned earlier on, that is to make sure that all the commitments that our leaders has made at the global level to end TB by 2030 are realized. And we know that these commitments, our leaders make commitments, and when they come back to the country, make commitments at global level. But when they come back to the country, these commitments are not really implemented to make sure that we end TB by 2030. So, as members of the Parliament have got. They are at the position to make sure that they can hold government accountable on all those commitments that they have made. So the TB caucus, at first, when it was launched by Dr. Aaron Motsoaledi, in 2018 at national level. It was under Professor Heru Hausler and TB Chavike were leading this initiative, and the SANAC Interministerial Committee in 2019 then resolved that the TB caucus be institutionalized within SANAC, and then it moved from TB HIV to SANAC, and they also resolved that the SANAC becomes the National TB Caucus Secretariat, and also the National Parliament to relaunch, as they did launch the TB caucus in 2018. It was functional for some time, and under the social and social cluster and health cluster at National Parliament, but and Dr. Deputy Minister Sibongiseni was chairing the TB caucus. So when he moved to the Department of Health, it stopped being functional. So we have been in constant communication with the National Parliament to relaunch the TB caucus. We have also taken it back to SANAC plenary and SANAC program review committee that will go to IMC to get assistance to push the National Parliament to relaunch the TB caucus and get it functional. And then the members of the TB caucus adhere to the principles of Barcelona Declaration that I will not go through again because Ms. Deborah has talked about it. And then also TB caucus is at different levels. I will pass this one also. So the caucus aims to accelerate progress to end TB through targeted actions. So there are policies, there are new scientific evidence that shows that proves how TB can be we can end TB by 2030. So the TB caucus aims to make sure that those policies, those new evidence that's been found is being implemented at the provincial level, the provincial, national or provincial levels. And then if those commitments are not being met, we won't be able to end TB by 2030. So members are very crucial in holding government into account, into making sure that they deliver on those commitments that have been made. The role of members, is the high level political leadership. And one of the members talked about TB financing. We need to make sure that budget allocated to TB is actually being used for TB activities when it gets to provinces or district levels. And then we need to make sure that the members need to make sure that there's accountability across all sectors, as we have already alluded to earlier on, and that some of the caucuses, what kind of destabilizes them is within the health portfolio. So the chair of the caucus is within the health portfolio. So once within the provincial parliament, once they move the chair to a different portfolio outside the health, it doesn't have any chair anymore. So that process has to start all over again. So that's what destabilizes the caucus in the provinces that we have already launched. So the advice is for the suggestion is for the chairperson of the not even the chair or the members to be from different portfolios to make sure that even when they move around, it's not associated with health, it's actually associated with all the portfolios. So the members of the caucus can also empower the community members, raise awareness on TB when they engage their constituencies, and also make TB information accessible to the community members, promote TB prevention, and support patients. We know TB patients, most of them start TB treatment, but because of stigma associated with TB and because of other social ailments, they tend not to finish the TB treatment. And then at the moment, what is been happening is only diagnosing people with TB, start them on treatment, and they don't get any psychosocial support, they don't get any counseling, or they don't get any financial support, because most of these patients are, nutrition support, they are impoverished, as one of the members have already mentioned earlier on. So it's crucial that members advocate for all these interventions. So we also need to draw lessons from HIV and COVID responses we have already mentioned earlier on. We know with COVID, the South Africans were aware of how many people who have COVID in the country. They realized the seriousness of COVID. They realized how many people were losing their lives because of COVID. As it stands, South Africans do not know the seriousness of TB. They don't know that TB is killing more people in the country. Like Professor has already mentioned earlier on, that more than 140 people die of TB every day. But as South Africans, we are not aware of that. So we need awareness amongst community members. We need live dashboards on TB. I know Western Cape is one of the provinces that's already having public facing dashboard that gives community members this information. And then also the stigma and discrimination that is associated with TB is what's making patients not finish their treatment. And also we need to advocate for access to newer TB treatment regimen. And also the other thing I have, I won't go through this one, Honorable Member, because it's just elaborating on what I have said on the previous slides. So just quickly rushing through it is we would like members to really raise awareness on TB, destigmatize TB, and engage businesses and private sector to support the TB program. You know, our TB prevalence survey that was done, the National TB Prevalence Survey that was done in 2018, and it was released, I think, 2021. It found that there is asymptomatic TB among high asymptomatic TB amongst community members. That means there is TB. People with TB who do not have any symptoms, and they were found with the use of chest x-ray and digital chest x-ray. And the current practice is screening TB by just asking the symptoms question, like, are you coughing? Are you having night sweat? And like that. And that's, if the person says yes to any of those, then they get tested. But then the survey found that most of them, they will have no symptoms, but they will still have TB. So we need digital chest x-rays that will screen a client for TB rather than questions. And the Global Fund has been funding these resources throughout the provinces that it supports. So we really need even internally to have financing for this resource. And the members are really key on advocating for the allocation and making sure that the TB budget allocations, they are used for intended purpose. Also need to work with research institutions to make sure that new findings and new interventions are being implemented, and then call for all government departments to play a role in the TB response and make sure that the multi-sectoral accountability framework is being implemented where all sectors promote TB prevention. I'll make an example, members. We can have government Department of Transport to communicate messages across all countries. We can have Department of Social Development to support people with TB with nutrition support. So TB is not only the problem of the Department of Health. All government departments need to play a key role in supporting Department of Health with the TB response in the country. And then we need integrated TB services in the health sector. And then I will move to the next slide because I've already talked that, and this will be my last slide, honorable members. The support that the TB SANAC can give to caucus members. So as we are SANAC, we support the provinces to with their we brief them with the caucus, what is caucus, the background, and what work can members do. And then we support the members to launch their provincial TB caucuses. And then we also induct a workshop for members. And as we have an induction workshop with the members, we draft a work plan for the provinces, provincial members on activities that they can implement, and we present to them. During induction, we work with them and they can decide which one they want to take on, which one it serves as the draft serves as a guide, not as what members need to implement, just as a guide, and then members can decide from there what activities they want to implement with timelines and then periodic meetings and tracking the progress on the implementation. And then also support members on the topics that they can bring to the legislature to engage other sectors, other portfolios on their response to the TB response in the country. And then we also support members if there's a need in their outreach programs. However, we don't support financially because we don't have the budget allocation for that. We just work with members and then give the necessary support that we can. So I know, Honorable Chair, I said it's my last slide. It's just to provinces that have launched. We only have got Gauteng, Northwest, Mpumalanga, Limpopo, and we have learned today that the Western Cape also. So these provinces, they have launched and they have been progress, especially Mpumalanga was the first, but there hasn't been much progress. They launched, but it's not really functional. But Northwest and Limpopo, they are really doing their best, with Northwest being very, very active. Even 2 weeks back, their health parliament was focusing on the TB caucus, and they also have done numerous outreach programs. They have visited hospitals, they have engaged patients and healthcare workers. They're working very closely with civil society. Gauteng launched, but it's been a struggle to have an induction meeting. There have been cancellations, but we have got a firm date for January to have an induction, and we have a program that is outlined for them, and then we will be going through it with members, and they will decide which activities they want to implement. The rest in red, they haven't really launched their caucus. We have been engaging them, but there isn't much progress. They are at different level. This slide, they just shows when the provinces were launching. I want to waste more time on this, and this one is just gives the slides how far each province is. So I will end here, honorable members. Thank you very much for the platform and the opportunity to engage you.
Thank you very much, Mr. Pole, and we are most fortunate to have you with us this morning and provide us with the necessary input. Thank you so much. Honorable members, you will now have the opportunity. I see Member Mare first up. Any other hands? I do not see any other further hands. Member Mare, please proceed. Thank you.
Lady, the question that come to mind after listening to the response now is, we must draw lessons from our HIV and COVID-19 responses. And then they say it must be multi-sectoral, and then of course there's a public TB dashboard. Now, I would like to know what lessons did we learn in our response to HIV and our responses to COVID-19? What lessons did we learn that we can now use in the fight against the spread of tuberculosis? And tuberculosis have various forms. You get a very serious, another one is just mild, but then you get serious, it is drug-resistant TB. So those people who have drug-resistant tuberculosis, they just go about spreading it. They cough and they spread it, and you can't cure it. What would your response be in terms of what you did in the case of COVID? Are you going to regulate the health services? Do you suggest we regulate it by ministerial fee? Are we going to have isolation of these people? For how long? Must they wear masks in public and wherever they go? Must they subject themselves to tests? And what tests must they regularly subject themselves to? So when you say we must draw lessons from how we manage HIV or how we manage COVID-19, I'll be very interested in knowing what lessons, if any, did we learn?
Thank you very much, Member Mare. Let me just double check if I do not see any further hands. I do not see any further hands. Dr. Nkwashe and Ms. Sopole, I do note your presentation makes mention of ending TB in 2030. However, do want to express the concerns when I have a look at your goals and your objectives. With our SA caucus being inactive and ineffective at this point in time, how doesn't that push back those goals that you've set? And we know we are in an already strained environment. How do you anticipate that we will come up to speed in terms of the end goal of eradicating TB ultimately? If you can perhaps just respond to myself and Honourable Marie at this point. Thank you very much.
Thank you, Honourable Chair. Responding to yours first. Yes, the global TB strategy, it's aiming to end TB by 2030. But it's clear that we are off track completely on those goals. And, that the global community have also recognized that. And hence we are calling for more interventions on ending TB, realizing even the impact of COVID, it also derailed, we have we have lost progress on what we have made on TB, the progress we've made on TB, because facilities were closed, healthcare workers were redirected, equipment that is used to test TB was, so people who were on medication were not able to access their treatment. So we were completely off track, even though before COVID we were already, it was it was clear that we were not going to meet those targets. And then implementing all the commitments that the global community is putting in place or proposing that countries follow, especially countries like South Africa, that is one of the highest burden of TB. We are actually highest in HIV, TB, and HIV and TB co-infection as well as MDR TB. One of the highest countries. So the NTB, the global TB community have realized that we are completely off track. So hence we are calling for all the interventions, all the commitments that were made, they are strengthened. One of the commitments that was made is the implementation of a multi-sectoral accountability framework on TB, realizing that TB is not only a health issue, it's got many other social issues, other issues of environment. So then working together, we will be able at some point. But I think Dr. Nkwashu will talk to the new national strategic plan on TB, HIV, and STI and those goals. So I'll then respond to the question by honorable member that is related to the COVID and HIV lessons. What lessons are we talking about that we have learned? I think it is my mistake. Actually, I was not very specific when I was talking to that. The lessons that we are advocating for from COVID. One is political leadership. We are saying we on our own, we cannot, as health, we cannot work on, continue to win the fight against TB unless we have the commitment. When COVID started, during COVID, we had the minister, the president, deputy, everyone talking about COVID, talking to the community about COVID, calling for multi-sectoral accountability, every sector, private sector, everyone to, raising awareness of the seriousness of COVID and what strategies that needs to be implemented. So here with TB, we are asking, saying, with HIV, we also had AIDS councils in all provinces where highest political in the government in the provinces, like premiers leading the AIDS councils, looking at the provincial AIDS response. So if TB also receives the necessary attentions that both COVID and political leadership that both COVID and HIV is receiving, the community will be aware of that, and all sector and all hands will be on deck basically with regard to TB response. So not necessarily saying people should be now quarantined or people, no, we are not saying that. We're saying we're asking for high political leadership, because when there is high political leadership, they will be able to hold government accountable. As officials, we won't be able to hold government accountable, but members are able to do that. So Dr. Nkwashu is fine. Yeah, thanks, honorable members. I don't know if we have responded adequately to your questions.
Thank you so much, Ms. Sapole. I will provide an opportunity to Dr. Nkwashu to respond. I will take your hand then soon after, Honorable Maree.
I wanted to say that, you know, if you look at the NSP, even the current one, the one that we're going to launch in 2023, it has different goals in it. However, it still has a goal that even specify or speaks to TB. And also on it, when we review it, looking at our end-term review of the previous one, we did not meet the targets that we have set, that are set, that no, we need to meet within that period of 5 years. So we still move with it. It's not necessarily a moving target. We set up a new target depending on the current status of the epidemic now. Thank you.
Thank you very much, Doctor. Member Maree, is it a new question or follow-up?
Thank you so much. I'm a bit disappointed, I must say it, and I'm saying it mildly. I was looking forward to this presentation. What we've learned, I must know about. There's nothing
Member
new coming out of there. Except,
Member Maree, my apologies. Member Maree, my apologies. We just lost you there for a second or two. Yes, so just make sure that your connection is stable. Please proceed. Thank you.
I hope you can hear me now, Madam Chair.
Yes, we can hear you. Yes, we can hear you. Thank you, member.
Thank you. What we were told now, you were given statistics, and I think the rest we all knew. The thing that I wanted to know from your presentation is, are you prepared to suggest that the lesson we've learned from COVID-19, not only the fact that it was multi-sectoral, but there was multi-sources of money? Should we not, where we see there's high incidence of tuberculosis, elevate this responsibility to fight it to a level where the premiers are involved with national ministers? We had these often discussions about it. Money was made available, huge sums of money. I don't see anything here but budgetary controls or how we are going to budget tuberculosis, like budgets were prepared for the fight against COVID-19. Isn't this one of the lessons we can learn? We even had special hospitals to isolate people. And the Western Cape is a leader in this regard. I'm sure that the Western world can be trusted.
Member Maree, does that conclude your question? Honorable members, am I audible?
Yes, we can. Can you hear me now?
We can hear you now. Did that conclude your question?
Okay. Are you? Yes, I want to know if you're prepared to say is that what we have learned, that if we give the Western Cape the money and the funds, we can manage TB like we manage COVID.
Thank you, Member Maree. I do see Professor Hausler's hand. You may proceed, Prof.
Thank you, Chair, and thanks to the Honourable Member for these really critical questions. Just if I could reflect and on some of the lessons learned that Citi did touch on, but using mobile health technology. So now with the same kind of self-screening app that was used for COVID, it's been adapted for TB. So it's called the TB Health Check. That allows people in the communities to link in and check if they have any symptoms or if they're at high risk, and then recommends the next steps to access facilities and to be tested. The National Health Laboratory Service now also SMSs the results of the TB tests and with prompts for people to go to start treatment. The public-facing dashboard that has been done in the Western Cape, and the Western Cape as a province has been a leader with that, and that provides much more real-time data, and that really is something that can be used by anybody who's involved in the response, any of the government departments and any of the civil society organizations, to see where are the TB hotspots and where do we need to focus our attention. The mobilization of resources is absolutely critical, and the multi-sectoral commitment with high political leadership to mobilize those resources, because TB is a major infectious disease killer still in South Africa, as I mentioned, despite it being preventable and curable. One of the things as well is there was a missed opportunity when people came for COVID tests. They should have been also tested at the same time for TB, because many of the symptoms are similar. So that bi-directional testing, and then making it easy for people to access their treatment through decentralized management and through decentralized models of care. The last point is we also have TB preventive therapy, and that really needs to be scaled up. There are new guidelines that say that anyone who's a household contact of TB should be, someone with TB should be tested, and then if they're positive, they start on treatment. If they're negative, they can start on preventive therapy to prevent them from going on to develop active TB. So there are a number of key interventions that can be implemented and lessons from COVID that can be learned. Thank you.
Thank you very much for your insightful input as well, Professor Hausler. Members, I do not see any further hands. I then assume, Member Maree, that you are covered.
The last speaker, Professor, yes, you touched on it, and I'm covered that he now says we should look at mobile units, testing units, identifying of hotspots, and that there should be high political leadership. I suppose he means that the premiers in each province must take charge of the fight, like they've taken here with COVID, and not leave it to a minister or a committee. We want it handled at cabinet level, where the premier is the leader of the cabinet. I'm happy with that response. I hope we will, when we have to make our resolutions, it will show that we are happy, all the members are happy with that response and proposal.
Thank you very much, Member Maree. That deals then with our second presentation and our question and answer session. Thank you so much once again to Dr. Nakwashu, Ms. Supoli, and to Professor Hausler for your inputs, your valuable inputs. Thank you so much. Members, we will then now immediately direct ourselves to the last presentation, which is of the Western Cape Department of Health and Wellness, which will be presented to us by Dr. Vanessa Moodley and Dr. Nonisha your surname, I'm so sorry, man, Fafare, but please do. Yes, thank you so much for that correction as well. We look forward to your presentation as well. You may proceed, Mr. Daza, if you can also flag that presentation for us, please. Thank you.
Good morning, everyone. This is Dr. Vanessa Moodley, and good morning to all the honourable members of this committee and to the invited guests as well. I'm going to take you through the first part of the presentation, which really just deals with the trends in TB diagnosis, and then I'll hand over to my colleague Noshina to talk you through our recovery plan. Next slide. Okay, so I think everybody would probably be aware that the impact of COVID has been quite severe in the Western Cape, and what we've seen from those years, from 2020, was a very drastic dip in TB diagnosis, and you can see that this is across all the districts. That from the first quarter of 2020 down to the end of 2020, we had a real decrease in case finding for TB, but this then started to recover, and at this point in 2020, we had recovered to diagnosing as many patients as before COVID, and that has steadily increased since then. Next slide. Just wanted to point out that if you saw the global report that's recently come out by the WHO, this pattern that you're seeing in our data is exactly the same pattern that is being seen across the world. And you can see that there is the steep incline in case finding after the COVID period. Next slide. This is important to note that not only did we have a disruption in services related to TB, but we also had a disruption with regard to HIV services, and that showed up in our testing. So you can see that our testing also declined dramatically, and that has started to increase, but you can see that it hasn't increased to pre-COVID levels yet. And on the next slide, you'll see that our patients remaining on ART also declined, and this means that we lost some of our patients. They disengaged from care during the COVID outbreak, and we haven't recovered to our pre-pandemic levels yet in terms of our patients remaining on ART. Next slide. This is our TB dashboard, and I've just drawn some figures on Wednesday. So this is latest figures. You can see the link there to the Provincial TB dashboard if you haven't had a chance to look at it yet. But if you look, you can see that the number of cases diagnosed is 50,641 for the last time period of a year, and the previous time period of the same months, we had 43,234 cases diagnosed. So you can see that that is quite a significant increase. We also have conducted 275,463 gene expert tests, which is an increase from 201,000 in the previous year along the same time period. So what we are seeing is an increase in testing and an increase in finding people with TB. Next slide. The other important thing that we are starting to see, and this is just really this year that we're picking this up, is that more of our patients are having to be admitted when they are diagnosed with TB, which tells us that people are presenting with their symptoms of TB when they are sicker than in the pre-COVID years. So you can see in that second diagram on your right, the number of people who died as well during admission for TB is higher than what it was in the pre-pandemic era. And you can see the purple and the pink blocks on the top is those patients who also had COVID as well. But even in the green bars, for those patients who didn't have COVID but were just admitted with TB, the number of deaths have increased compared to 2019. Next slide. Okay, I'm going to hand over to my to Noshina to do the rest. I had another slide on the metro situation, but I think that slide seems to have dropped off. Noshina, you can go ahead.
Thanks, Vanessa. So I will now go through our reset, recovery and resurgence strategy that we have in the province. So basically, what the reset, recovery and resurgence strategy for the province is looking at, it's basically looking at what are the lessons that we've learned from COVID over the past 30 months and how we can use those lessons to really work towards our ultimate goal of ending TB by 2030. So in terms of our resurgence, the outlook is really over the next 2 years, and it's looking at how we can balance the COVID demand with core health services and looking at reopening of services and integration of some of the COVID services into our everyday health service. And then in terms of recovery, it's our outlook over the next 5 years, which aims at ensuring reform across that occurs across domains of service delivery, governance, public health policy, and also universal health coverage. And then in terms of reset, it's our outlook over the next 10 years, which looks at how we can work towards universal health coverage reform, and also mitigating social determinants of health. And this is with the ultimate goal of ending TB by 2030 and overall health and wellness by 2030 and beyond. Then our reset agenda is really a process of doing, being, and becoming. So when we speak about doing, it's looking at our service redesign journey. So what we want to do is provide the right care at the right time, in the right place, at the right price, and putting people first. Then in terms of being, it's really the governance and culture journey. So we want to be a resilient system with connected, value-based leaders that act as steward for people's health and well-being, and building a healthy system for every person. And this is all with our aspiration in mind of becoming a health system that is people-centric, trusted, and equitable towards a healthy society. Then our TB response plan. So in April of 2021, the Premier had launched a TB response plan with the Western Cape Government Health as well as civil society. And the objectives of our response plan was firstly to raise awareness, to raise a sense of urgency and awareness of TB as the leading cause of death in the province for more than a decade. Then secondly, we wanted to reduce the number of new infections. We also wanted to increase the speed and number of those diagnosed, enable early initiation of treatment, and provide adequate support to improve treatment completion rates. And then the fourth and final objective was to meet the global and local commitment to end TB by 2035. So this is just a look at the key focus areas of the provincial TB recovery plan. And so we really, the four focus areas was firstly communication, so looking at social mobilization and advocacy. So for that, we looked at how we can use our existing materials that we could just review and print as deemed necessary and suitable. We also have the public-facing TB dashboard that Vanessa has shown you, our social media campaigns to promote the screening app, and then also developing key messages to encourage clients who are lost to follow up to return to facilities. And the second key focus area was to prevent new infections and case detection. So here we have incorporated the self-screening app into the TB dashboard. We've combined screening for COVID and TB, and it's also been included in our PAC guidelines. And then we've also got our community health workers to assist us in reaching vulnerable individuals and communities with TB screening and referral. The third focus area is early detection and adherence support. And this really looked at innovations to help in this area. So we have our digital X-rays that have been piloted by TB HIV Care at 4 sites. So there was a mobile site and 3 fixed sites. Then we have the introduction of telehealth to trace clients who were lost to follow up, and we have also been expanding on the telehealth model to ensure linking of newly diagnosed clients. And then we also have developed and are busy finalizing our counseling strategy that aims at how we can include prevention and promotion strategies at every point of contact through how we engage with our patients. And this includes things like your treatment literacy and health education, and looking at the roles and responsibilities around all healthcare workers to implement that. And then finally, we have our whole of society approach, which really looks at strengthening the multi-sector response at district level, and also integrating the functions of district councils on AIDS and TB to district health councils. And looking at nurturing and sustaining key partnerships with civil society as well. And then here I've just linked what we are doing within our provincial response plan to the national TB response plan. So the national TB response plan also has 4 focus areas, but they are referring to it as the prevention, case detection, linkage to care, and adherence counseling and support. So you can see I've used the activities that we are doing within our key focus areas and aligned it to what national is requesting from us. So there is good alignment between the national TB response and the provincial TB response as well. Yeah. Then there's also within our Provincial Council for AIDS and TB within the province, that's chaired by the Premier. There has been the concept that has been developed for localized geographic TB and HIV response. The overview of the proposed strategy. So it's really looking at a localized trigger response to HIV and TB, and also to follow key recommendations that have been made by the subcommittee of the Provincial Council for AIDS and TB, which is our program review working group. So there are 3 focus areas. So it's a localized focus on priority areas in defined geographic locations, and then also expanding the 1990 targets to include a focus on prevention. I'll tell you a bit more about that later. And then the due consideration that must be given to social and structural drivers of HIV and TB as well. So we're also using a public health approach. And if you look at the diagram on the left-hand side, it includes biomedical interventions, behavioral interventions, and structural interventions, although they are still, seen as independent entities and a trade-off, in terms of what we want to focus our energy on and invest in, with biomedical interventions really being the key focus, within the current perspective. So what this framework is looking at is trying to move to a more holistic perspective, as shown on the right-hand side, which follows the social ecological framework, which looks at the interdependencies of the various biomedical interventions, behaviors, and structural interventions, and how we need to work together, in terms of our environments, policies, and laws, looking at how we can address patient behavior and encourage more healthy behaviors and reduce the high-risk behaviors that people engage in, with the ultimate aim of supporting treatment adherence, and then also how we can then incorporate biomedical interventions to support this as well. So in terms of expanding the 1990 targets, so in terms to intensify the HIV and TB response with the aim of reaching global targets for HIV and TB, we are looking at, in addition to the 95, 95, 95, adding an additional 90 that focuses specifically on prevention. So basically, what the discussions was that when we are screening for patients and testing patients, the aim now is to start those who test positive on treatment as soon as possible. But there's a gap in terms of those who have tested negative, where we should look at how we can implement prevention strategies so that they can stay negative and not in a few months' time come back and test positive and then have to start on treatment. And then the approach also looks at the link between social drivers and health outcomes. So as you can see, the social and economic environment is the bulk of the in terms of the drivers of health at 40%, followed by health behavior. Clinical care is only 20%, and then the physical environment makes up only 10% of the drivers of health. So it really makes us think that if we are focusing all of our energy on the 20% of clinical care, then we are really missing, the interventions that can take place to address social and economic factors as well as health behavior factors. And then I just want to highlight the National Strategic Plan for that will be launched now in April 2023. So there is a draft plan that has been circulated for comment, and with the aim of finalizing it by April 2023 for implementation. So the strategic goals for the new NSP is to break down barriers to achieving HIV, TB and STI solutions, to maximize equitable and equal access to HIV, TB and STI services and solutions. And to goal 3 is to build resilient systems for HIV, TB and STIs that are integrated into systems for health, social protection and pandemic response, and then to fully resource and sustain an efficient NSP led by revitalized plans that are inclusive and hold people accountable. And then what is new in the NSP? So the focus in the new NSP is really to reduce inequalities, deliberate efforts to remove barriers to accessing health and social services. There's a focus on integration of mental health services into our response, inclusion of viral hepatitis prevention, treatment and care, as well as cervical cancer. Multi-sectoral commitment and accountability of financial and human resources. There's also a greater focus of community-based and community-led interventions, as well as testing and treating strategies for TB and STIs. So these are just some acknowledgements. And that brings us to the end of our presentation. Thank you very much for the opportunity.
Thank you so much to both Doctors Moodley and Pufri for your indulgence of this committee this morning. I will now afford members of the committee the opportunity, and I recognize Honourable Murray.
Thank
You
you,
may
Chair
proceed.
Lady.
Thank you.
Thank you so much. Can you hear me?
Yes, you are.
Can you hear
Audible
me?
member. Yes, thank you.
Thank you. Interesting, the department, I found what you said interesting. That's all I can say at this stage. I just want to know that, what about mother-to-child transfers? I know this is a big thing with HIV. And myself and Dr. Abdullah at the time, when I was still the Minister for Health, Western Cape, went to Boehringer Ingelheim in Germany. We got a 5-year supply of nevirapine and AZT to give to pregnant mothers, and we had a 50% success rate in mother-to-child transfers been stopped and halted. Now, if a woman has a resistant TB and she's pregnant, I want to know from a medical perspective, can the baby contract tuberculosis? At what stage should mothers or anybody in a household be isolated from the rest of the family members if they have contracted tuberculosis? Who monitors them? Do we have nurses? There used to be home carriers that went around to specific patients to make sure that they use their medication, that they adhere to the recommendations from the health department, because people don't like going to day hospitals and clinics sitting there the whole day. But it's nice if the nurses working for the department or for the clinics or day hospitals go visit them at home. And you say the drivers of health, 40% of the people, the causes for contracting TB, 40% of the cases derive from social and economic circumstances. So those two, what focus is there on social and economic factors also? And what do we do to protect families like we protected families against anybody who has COVID-19? How do we protect families from persons who might be staying with them who have contracted tuberculosis, and is isolation enforceable on them in terms of the current law, or do we need again regulations to monitor that people do adhere to isolation? Thank you.
Thank you very much, Honourable Murray. I do not see any further hands, members. If you still want to pose a question to the Western Cape Department, you are now most welcome to do so. I'll just double check for hands. I do not see any hands. Oh, I do see now. I recognize you, Honourable van der Westhuizen.
Good morning, Chair, and thank you very much. Chair, it seems to me as if we've got a trend that is quite worrying. And my question is, to what extent in the past, in terms of the history of our statistics, have we seen similar trends, and what were needed in the past to reverse that? Or you know, can we go back a little bit further in terms of you know, would we be able to learn some lessons if we look at the history of the trends? Is it also similar to COVID, an illness that we experience in waves? Thank you, Chair.
Thank you very much, Honourable Marie. And then if I can just, you know, health is everybody's business. And in terms of our whole of society and whole of government approach, if you can perhaps just provide us with some insight into how the department addresses those social determinants, especially as made mention of the 40% of social and economic environment. That will be all from me for now. Thank you very much. I'm sure there will be follow-up questions, but doctors, you are most welcome to respond to the three. Thank you.
Thank you. So maybe I'll just start off with answering some of those questions around susceptibility for mother-to-child transmission and also isolation periods. So yes, it is true that if a woman is diagnosed with TB during a pregnancy, she can pass this infection on to the child, and the time that the child would be most vulnerable is immediately after birth, when there's close contact between mother and child. So we have got guidelines on this. We recommend that mothers who are infected and newly diagnosed wear masks while they are breastfeeding. We try as far as possible not to interrupt the breastfeeding part of this interaction, because breastfeeding is very, very valuable for newborn babies, especially in our environment, and we don't want to disrupt that. So we do encourage wearing of masks. Just to point out that a patient becomes non-infectious after 2 weeks of receiving treatment in the case when they have drug-sensitive TB, and by a month after they've started treatment with drug-resistant TB, they are also non-infectious, because our drugs are very, very effective at reducing the load of the bacilli that people are coughing up. So if you have somebody who is infected in your household, they are advised to wear masks for that first 2 weeks if they have drug-sensitive TB, or a month if they have drug-resistant TB. In the case of drug-resistant TB, they're also put off work for that entire period of time, and they're advised to stay at home and to continue wearing masks. We don't have a way of enforcing that per se, but we do have community health workers that go out to households, and especially in that first 2 weeks when they start treatment, the community health worker will visit the household, will screen people within the household, and will check that the patient knows how to take their medication and that they are taking it. We had some disruption in this community health worker service provision during the COVID period, so some of those patients did not have access to these services. And even now, some of our services have not been restored completely. But the standard of care is for the community health workers to still go to households to advise patients on taking their treatment and protection of people within the household as well. And then on the trends question, I'll pull up a slide just to give you an idea of what the trend is just now. And in the meantime, maybe Nashina can talk to the social and economic factors that were on one of the slides that you presented. Thanks.
Hi, thanks, Vanessa. So just in terms of the social drivers, so at the provincial level now, as I mentioned in the presentation, we do have the Program Review Committee, which is a sub-committee of our Provincial Council for AIDS and TB. So that is where the HODs from the various departments are present as well as some partners. So there are some NPOs that are present at that meeting as well, where at this level we have started that the conversation in terms of how we can work together, and really in terms of looking at how health is everybody's business and getting the various sectors to work together towards addressing TB, and that is how we came up with the trigger response as well. So the next steps for that is really looking at what has come out of these discussions, acknowledging, that social drivers do count for 40% of our health drivers. And then we are working towards an implementation plan. So when the new NSP comes out, we are working towards having developing a provincial implementation plan that will be localized in certain hotspot areas, which will then hopefully be able to filter then the information that has been shared at the provincial level into an operational level, and starting first in one rural hotspot and one metro before then expanding it, to a broader area. So that is really how we are trying to address the social drivers, in collaboration with obviously the Department of Health, Department of Social Development is there, education is there, so it's really everybody really working together to come up with a combined response, and trying to see how it will then make sense on a practical level in terms of implementation. So I'm not sure if that is answering your question or if you have a follow-up question.
Thanks, Nushina. I've just got that slide. I'll just pop it on just to give an idea. Can we see that, Nushina?
Yes, you can.
Yeah, this is just to describe what the trend has been for TB in the past. And you can see that we had a huge burden of TB, which was made worse because of the HIV epidemic. And over the years, the thing that has made that, well, there's two things that have made huge differences to our burden of TB disease. And the first one is the introduction of ARVs, and that really brought down the burden of TB nicely. But the other thing was also the introduction of gene expert testing, which was in 2013, which allowed us to diagnose TB much faster. So now we can get a result within 48 hours and we can start patients on treatment as well. So those are the two things that really impacted, and you can see how the trend has come down. And the concern, of course, globally is because this is also a global trend, that COVID has and then put some COVID has changed things, so we have seen this slight upturn in increased number of cases. But we don't expect it to go back to anywhere what it was in the past, because we still have ARVs, we still have good tests, and our drugs are still very effective. Thanks.
Thank you very much. Honorable Marie, I see your hand. Is that a follow-up question?
Yes, the issue here is they're showing us figures of 2016. That scarcely help us because we want to know what is the situation now. We're in 2022, and what they just showed us on the screen is 2016. So it doesn't help us much. I just thought perhaps that the department could update us a bit and let us also know what is the situation now, and is it true that people of 60 and older, do they succumb to TB far more rapidly than young people? Because I just had a quick look at that graph, and it seems that people 60 years and older, most of the deaths, or am I wrong? Or did those for young people come down rapidly and those for elderly stay the same?
Thank you, Honorable.
Yes, thank you.
Thank you, Honorable Marie. Let's seek the clarity from the department. Thank you.
Thanks for the question. The slide on the from 2016 onwards was in the deck that I presented. I can show it to you now, just in case you missed that. And that was on this slide. You can see this is the TB diagnosis from 2017 onwards, and this is where it's showing that dip that we had for the COVID dip in 2020. So this is data up to 2021. Okay, I hope
Sorry
that's...
to interrupt. What is the top graph, the one in black, that showed a dip and then an escalation?
Yeah, so that is the TB, the number of drug-sensitive TB cases that were diagnosed. So you can see
You're happy, Honorable Marais?
We had stabilized
well,
from 2017.
The graph shows an upward curve. I'm talking, can you hear me?
Yes.
We can hear you. Please proceed. You are breaking up, Member Marais.
The graph there. Excuse me?
Member Marais, you were breaking up. Can you start afresh? You were breaking up.
Thank you. What is that dip? What did that dip represent in the graph? And then you show a spike going upwards. What is that dip?
Honorable Marais, perhaps you must. Member Marais. Member Marais. Member Marais.
What is the spike? What caused the spike?
Member Marais.
I hear you.
Yes. Could you perhaps try switching off your video, because your sound is coming through distorted? And if I can ask you perhaps just to start afresh again. Thank you.
Thank you. Thank you. I thought perhaps you could see my lips if you can't hear me, but I'll switch off the camera now.
Please go ahead, Member Marais. Thank
you. There is the top graph, the top one. Okay. What caused this drop? What caused the spike? I lost you.
I think I've got the gist of the question. I'll just orientate you to what this graph is saying. So this graph is a breakdown of the number of cases that were diagnosed between 2017 and 2021. And this top line is the cases that were diagnosed for the city of Cape Town, which is the Metro District. And the other lines are representative of all the other districts. So what had happened after that graph that I showed you from 2016, where the prevalence and the incidence of TB had fallen dramatically, is that it then plateaued, and it was sort of the same between 2017 to 2020. And then we had COVID, and you can see this big dip that we're seeing is what happened when services were disrupted during that COVID period. So part of it is to do with the lockdown. So the lockdown had two effects. The one was that the services were de-escalated, and a lot of the clinics were only seeing patients who were emergencies, and the services were reduced. But the other part of it was also that patients were afraid to come to clinics because they were afraid of getting COVID, and a lot of the patients stayed away and didn't come for TB testing. Now, we also have a standard thing that we do within clinics to look for TB patients, is that we screen all the patients who come to the clinic for TB symptoms. And so you can see that if there were less patients coming to the clinics for other services and other treatments, it would mean that there would be less patients screened, and therefore we would diagnose less patients with TB. So those were the factors that led to this huge dip in TB cases. And you can see, because the lockdown was severe, and then we had another 2 lockdowns after that, you had this impact. But thereafter, the services re-escalated, and when services were restored and more people were coming to clinics, you can see the uptick is we started screening people again for TB, finding more people, and you can see that's why there's a steep increase there, because we started testing more, finding more cases, and putting them onto treatment. Now you can see that it then starts to continues to increase. And that's what I showed you, that we are seeing an increase in the number of cases compared to pre-COVID, because we would expect that if we didn't manage to find and diagnose a lot of patients with TB, they would be in the community and they would have infected other people. So we can expect that there will be an increase in the number of cases of people who have TB, and we will be, the more testing that we do, the more cases that we will find and we will need to put on treatment. I hope that answers your question. It's just really, if you diagnose less people over a certain time period, you create a situation where there is more infectious people in the community, and that's why you will have more people presenting later on with symptoms of TB. Thanks.
Thank you so much, Dr. Moodley. I see the hand of Professor Hausler.
Thank you, Chair. Maybe just one point of clarification was the earlier graph was showing TB deaths, which decreased dramatically as a result of antiretroviral treatment, but the more recent graph is showing the number of people diagnosed with TB. As Dr. Moodley said, we actually do want that number to increase. It sounds sort of counterintuitive, but in fact, the estimate for South Africa is that only 60% of people with TB are actually diagnosed, and that's a concern. So we need to increase the number of people tested and diagnosed so that we can get them on treatment, and that will be good for their health and also prevent further transmission. So all of the new interventions that are being implemented with targeted universal TB testing, so testing people regardless of symptoms if they're in high-risk groups, and the increased use of digital chest X-ray that will also diagnose people without any symptoms, and then trigger a gene expert test. Those are really critical so that we find the missing people with TB and get them on treatment. So I think it's just something to keep in mind that in a way it will be good if we see an increase in the number of people diagnosed so that we can ensure that they get on appropriate treatment and prevent further transmission. Thanks.
Thank you very much, Professor Hausler. Member Mare.
Thank you so much for being with me, Lady Chair. I have one last question, and then I won't have any more questions.
I will hold you to that, Member Mare.
Given all the information you... Thank you so much. Thank you. Taking into account all the information you've just presented to us, all the facts and the figures, and looking at how many informal settlements we have, that must be a breeding place for tuberculosis. People staying in, and the court says, but you can't move them and break down that structures. So what can the health department do to let the court review?
Member Mare, we really have difficulty hearing you. Some parts sounds very, very far away, and then you come through very hastily, and then there's a break up. So it's very difficult to hear you at this point in time. Could you perhaps try from another angle in the vicinity where you are?
I will definitely try, because I think this is a very important question.
The sound is better now. You can go.
Is it better now?
Yes, it is. Thank you.
Thank you. Thank you. You know, the courts have become legislators, but they are not health practitioners. They're legal practitioners. And they allow all these mushrooming informal settlements. That is a breeding place, I'm sure, for tuberculosis.
Member Marais, we lost you there, unfortunately. Can we perhaps...
Can you hear me now?
Please proceed, member.
Can anybody hear me?
Yes, we can hear you.
Thank you. What can the health department do to assist the premier of this province to bring to the attention of the courts that they must find a way of circumventing the PI Act, which says you cannot move somebody if you haven't removed them within 48 hours, which I think is a stupid law, but okay, I can't remove it. Now, that people live in conditions that causes breeding places for tuberculosis. And with all the information at your disposal regarding this matter, what can you do to assist the Premier to have orderly town planning schemes and to force people to move to adequate housing provided for them, and they mustn't have a right to stay in those inadequate slum conditions just because there's a PI Act? Can anything be done? Can you provide this committee with your view on people who live in such squalor?
Thank you, Honorable Marais. I'm not sure whether that question falls within the ambit of the Health Department, but I would afford them an opportunity. Perhaps there is engagement in terms of intergovernmental approaches. If not, I do encourage you to, in terms of your parliamentary privileges, to pose the question to the relevant department. But let me afford the Department of Health and Wellness whether they could shed some light on the question.
So I think you are right. It doesn't fall within our ambit really in terms of housing and those. So we are trying to look at it from a whole of government and whole of society approach so that we can get the right people on board to then help us address some of those issues. But I definitely do not have an answer for you in the practical ways of how we would do that at this stage.
Thank you very much, Dr. Ververay. Honourable members, I do not see any further hands. We've had quite an extensive discussion this morning, and I do assume that members are most enlightened by what we have received this morning. You still do have your presentations. If you have missed out on anything or you do have further questions for clarity that you wish to pose later on, we will also have the opportunity in terms of resolutions and recommendations to put forward the work that we have done this morning. Then please allow me on behalf of the committee to thank our guests this morning. Thank you for your indulgence. Thank you for all the valuable information. We are not all health practitioners, but we are representatives of the people. So within our mandate and the establishment of this committee, I'm sure that you can realize the commitment and the determination from the Western Cape Provincial Parliament to work with all of you hand in hand to end this disease. So you definitely do have our commitment. I also wish to thank all members, although we still have some committee business to conduct, to encourage members, those that are perhaps not here this morning, that tendered an apology. This is a very important mission. And we would want all hands on deck to make sure that we do our part in the fight in the Western Cape. Honourable guests, I would just want to ask you at this point briefly, Professor Hausler.
Thank you, Chair, so much for your leadership and for your commitment. I just wanted to ask a question regarding Monday. I believe I was contacted by Dr. Sadiq Karim, and he and the head of health had requested that TB HIV Care provide HIV testing services and TB screening services at the Provincial Parliament on Monday, which we will do, and we're looking forward to that. But I wondered, is it too soon, or would it be possible for us to also come with forms for members of Parliament to sign on to participate in a provincial TB caucus on Monday, or is that too soon, or do other processes have to happen?
Yes, thank you very much for that, Professor Hausler. That is one of the items that we will be discussing as the committee in our session now, after I've excused our guests. Contacting the department was a proactive approach so that at least we will have an answer whether the department would be able to. But this committee is still to take a resolution formally in terms of Monday. And then in terms of the formal launch, which will most probably happen earliest next year. I think also the Premier expressed his view on a substantive approach to that as well. It shouldn't be an occasion where we just set loose balloons in the air and, you know, just speak to it, but that we include all stakeholders. So that obviously will take some proper planning from WCPP, as well as give some direction from this committee as well. So we will be dealing with the committee business after this, as indicated, and we will definitely keep all stakeholders abreast as to what the committee has decided. Is that in order, Professor Hausler?
Yes, thank you so much.
Not a problem. Before the guests leave, can I please ask members just to switch on their cameras? I think this is a very significant moment for us in the Western Cape. We share the commitment and we really are dedicated to drive this process and to drive this issue within our various communities. We would just like to have a nice group picture for us, please. And so we can somewhat check if everyone is still wide awake.
So, yeah.
Did you say I can also put on my...
Yes, yes, please, Member Marais. We will never get tired of your face. Unfortunately, your connection let you down there for a moment.
Flat. Okay.
Just see if there's some other members as well. Mr. Daza, will you be able to get us in full screen?
No, I'm taking a couple of pictures. So
Oh, you're already busy. You should warn us.
Oh no, I was just taking as pictures come and go.
Okay, sure.
So we'll see. Yeah.
You've got us?
Yes.
Thank you so much. Thank you so much, everyone. And we look forward to engaging with you going forward as the ad hoc committee. Have a wonderful day and have a most blessed weekend and be safe. Thank you.
Thank you.
Thank you, Chair.
Members,
Thank you,
please
bye.
don't leave, members.
Oh, okay.
We just have some committee business that we need to attend to. Colleagues, what Professor Hausler was referring to this morning was that I contacted the HOD. As members know, there was an ATC that us as WCPP will be in the House on Monday. Since we had World AIDS Day on the 1st of December and we still have, or we're still within the month of December, I thought I would propose to the committee that we, this coming Monday at 1 o'clock, after the House session, that we engage the TB and HIV outreach unit of the Department of Health and Wellness, whether they would consider doing voluntary testing for HIV and TB. I think it will really be a very good kick-off to what we are embarking on in the Western Cape, as we are, as parliamentarians, setting the perfect example to the rest of the Western Cape. It is obviously voluntary, but the department did indicate that they are willing to assist us this coming Wednesday. It will be on the premises on the 6th floor, there at the Marble Foyer. So we just need as a committee to give our input whether that is something that the committee would want to do on Monday, and then take the formal resolution. And then Mr. Daza will then be the designated procedural support officer that will engage with the department on further logistical arrangements, but that will then be set for this coming Monday at 1 o'clock. So members' input are most welcome, and whether this committee has got the appetite to do such an exercise. Obviously, it will not just be the committee. We will extend the invitation to all WCPP caucus members. And I think it would give a good indication to the rest of the province that we are setting the example, we're setting the tone, and we're encouraging the rest of our constituents to do exactly the same. So members, are you comfortable that we embark on? And obviously, if we do take the resolution, we will write then after this meeting to the Deputy Speaker and to the administration and to the various party whips, inviting them and encouraging them to this voluntary testing session that the ad hoc committee is embarking on Monday. So your take on that, members?
Chair Lady, it's all okay with me. Thank you.
Are you happy, Member Plato?
Yeah, definitely.
Thank you so much.
Yeah, I also don't have a problem, but Member Christians, but I will not partake in the testing, but I don't have a problem. Thank you very much.
Thank you so much, Member Christians.
Chair, I don't have a problem either. It's Member Fry.
Thank you so much, Member Fry. Member Bartman, I heard your voice there.
I indicated in order. Thank you, Chair.
Thank you very much, Member Bartman. Member Marais, are you happy for us to proceed?
Yes, I'm quite happy for you to proceed, seeing it's voluntary. You can't be more democratic than to say it's voluntary. So I go along with it.
You will need a triple needle in his arm.
Thank you so much, members. Then we will then provide the mandate to Mr. Daza as we have resolved now. Honourable members, in terms of the terms of reference for this committee, and that is why it was quite important for us to have these various presentations, because this will greatly impact on our terms of reference as a Western Cape committee. So, Mr. Daza, will it be realistic for us to ask members to provide input? Will we be able to provide them with a draft document, and members can then provide their input accordingly and provide that to myself and to you? Can you just give us an indication, Mr. Daza?
Yes, Chair. No, it's fine. It's really up to the committee. We need the terms of reference determined by the committee. It needs to determine its own terms of reference. So then they can be sent to me and you, and then we can table them in the next meeting. We can give them a deadline, so the committee can agree on a deadline for submission of those inputs from members. Thank you.
Sure. Members, are you happy then that Mr. Daza provides us with a draft document, considerate of what we've heard today, considerate of what your inputs would be, that we contain it in that document, and then we agree on a reasonable time frame so that we can also elaborate on that terms of reference in our next meeting, but also then adopt our terms of reference going forward. Are you happy that we proceed in that way?
I would just like, Chair, I agree with that we must draft terms of reference, but just to get this bipartisan or tripartisan cooperation, we must find a way of also involving the whippery before taking this any further, that we involve the whippery of the various parties, that our proposal here today be referred to the whippery, and if the whippery also is happy with it, then we forward it any further, whatever avenue we're going to take to stop repetitions of grandstanding in the House.
Thank you very much, Member Marais. We note your comment. So we are in order that we proceed in that fashion then. And Member Marais?
I will go along with that, whether they accept my suggestion that it be referred to the whippery or not. I think it's a good idea I'm just trying to learn from the past, like we're trying to learn from COVID.
There's always lessons to be learned, Member Marie, and each and every input and comment in this committee is valued. And I think this is a first for many of us. So we will definitely navigate our way through the processes as a collective. Otherwise, we are bound to fail, and not one of us want to fail. So we will definitely treat anything that this committee are dealing with collectively as one committee. So thank you very much for your input. It is duly noted. Honourable colleagues, then Mr. Daza, our program population, our committee program population.
Yes, Chair. I think from our side, we would like members to give us an idea of what items they would like us to include in the committee program going forward. Thank you.
May I address you on that, Chair Lady?
Please do, Member Marais.
I think, first of all, from what we've heard now, we want to become part of a global initiative. And we now heard that the provinces has a right on a regional basis also to get involved with this global TB caucus, which is an independent body, and we can, I'm sure we can learn, but other countries can also learn from us. So I think the first thing it must be is that in this resolution or whatever we in terms of reference is, that must be number one. Everything else will follow from there. What we need to do, we can't put ourselves in a straitjacket and now say, what is the limitations that we give ourselves? No, once we part of this regional global caucus, we will come back with new fresh ideas, which we want to incorporate in any proposal with terms, what our terms of reference should be.
Thank you very much, Member Marais. And I think we can also accept that with the times, that program would also perhaps not even be cast in stone. That as we embark on and what emanates from those engagements will greatly impact on our program as well. So, Mr. Daza, can I ask that the draft document that you have, we can just speak briefly after the meeting as well, just to make sure that we do capacitate all members with the documentation as well as with a clear timeline or deadline that we would want members' proposals on, also taking into consideration that we are ending off the parliamentary year, but then afford members the opportunity that during the time of rest that they can also apply their minds, even consult further into providing input into our program as the committee. So we will certainly do that in terms of the program. And then, honourable colleagues, based on today's engagement, are there any resolutions or recommendations from your side going forward based on today? Mr. Daza, did you note any from your side?
No, Chair, from our side was basically questions and answers. So I haven't noted any, I haven't noticed any request for information only from members. Thank you.
Specifically, yeah.
Yes.
Honourable members, can I also ask that I know there would be some follow-up, something you would perhaps think about once we've ended off this session. And I would like to leave the window still open for you to be able to do some resolutions and recommendations, because I think today was a very important session. So let me also just engage and liaise with Mr. Daza in terms of what reasonable deadline we can provide to you, also to then submit resolutions and recommendations. Will that be in order with members?
I think that would be the sensible thing to do. I agree with it.
Thank you so much, members. If there's nothing further, we don't have other, Mr. Daza, do we have any other committee business outstanding?
Yes, just to adopt the the minutes, the previous minutes, Chair.
Oh yes, please do share that with us on the screen.
Okay.
Members did receive the minutes as well, but let us just put it on the screen as well. Honorable members, on the screen, our 7th October 22 meeting at 8 o'clock. Kindly check your attendance on page 1. Thank you very much, Mr. Daza. You can move along. We then dealt with the election of the chairperson in terms of Standing Rule 81.1. Mr. Bosman moved. Honorable Marie seconded. Chairperson was duly elected. And the resolution that we took on the day our meeting ended at 8:13 on the day. Members, are you happy with the minutes of the 7th of October? Can I ask for a proposal and a seconder?
I propose, Chair. Yeah, I agree.
Thank you very much. I heard Honorable Plato and I heard Honorable Christians as a seconder. Thank you so much, honorable members. That deals with our business of the day. Allow me once again to thank you all so much for your valued input, and I really do look forward to the new parliamentary year, and as to which we can really drive the issues within our province as a collective. So thank you so much for today. I wish you all a wonderful and a most blessed weekend, and please be safe. So thank you so much for today. This meeting is now adjourned.
Thank you so much,
Thank
Chair.
you.